There's actually over 100 studies now that indicate there's 17 distinct mechanisms that the mRNA injections may induce cancer. In fact, two population studies just came out in the past year or so. 8.7 million people combined. They found the COVID shots increase your risk of 7 major cancers: bladder, breast, thyroid, colorectal, gastric cancer. All of these cancers were up. They compared vaccinated to unvaccinated. And so we're seeing these cancers. We see CDC data over 100,000 excess cancer deaths in the United States since 2021, since the vaccines rolled out. So it's a very concerning. Found 100% of COVID-19 vaccinated individuals have these circulating anomalous amyloid microclots in their blood. This is misfolded fibrin that sticks to many biologically active materials circulating in the body, and it conglomerates into these irregular masses that block blood flow and cause all sorts of horrible issues. It's the exact same pathology that has been identified as being behind the long, white fibrous clots being pulled out of corpses worldwide. Majority of embalmers now across the globe do now pull these white fibrous clots out of corpses, and this is what's behind them. This is very serious. These have to be pulled off of the market immediately. Studies ever conducted. The first one's by Fuksova and colleagues. This had 99 million people in it. They found 500% increased risks of myocarditis, 300% increased risks of spinal cord inflammation, which can be permanently disabling. It can cause paralysis. And then we have the second largest vaccine safety study ever conducted, which was published a few weeks ago. That had 85 million people in it and had a control group. So it was about 40 million vaccinated, 40 million weren't. It was a meta-analysis. They found 300% increased risks of heart attack. They found 200% increased risks of arrhythmias. They found about 250% increased risks of stroke. And so now we have the largest population sizes ever studied that were vaccinated, and we find these.
Public health policy would have been very different had the American public been made aware that a virus from a lab in China was going to serve as the foundation for an emergency use authorization mRNA products being mandated by the former administration. Dr. Fauci's role in the cover-up was intentional.
Yes, intentional.
Dr. Fauci influenced the analytical process and findings by leveraging his position to ensure the IC consulted with a conflicted list of curated subject matter experts, public health officials, and scientists. This included some of the authors of the paper, The Proximal Origin of SARS-CoV-2.
Wow. Think about what he just said under congressional testimony. If the American people had been told the truth about where this virus may have come from, the entire COVID response would have looked different. The mandates, the censorship, the ruined careers, the people called conspiracy theorists for asking obvious questions, and now a CIA whistleblower says the process was influenced, curated, and covered up. This wasn't trust the science. This was protect the narrative. And if this testimony is true, every American deserves names, documents, and accountability.